Today we're going to talk to you about our new disposable gowns that we will have here at Great River that are replacing our current reusable gowns. So we have a total of 3 in-house. The first one will be the most commonly used gown, and it's known as our universal gown. These are the isolation gowns that you will find stocked primarily on the isolation carts and used for patients in isolation. The second gown, which will be located in designated units and locations, will be the 2 extra large gown. To know that this is a 2 extra large gown, there is a sticker that goes over the right chest that will tell you that it's a 2 extra large. The third gown that we will have in-house, and this one will be located only in the emergency department, is the trauma gown. Today we're going to talk to you about the donning and doffing of these isolation gowns, as it is a little bit different than our current use with the reusable gowns. The donning and doffing of the universal gown, which is the primary gown, and the trauma gown are exactly the same. Then we will also be showing you the donning and doffing of the 2 extra large gown, which is slightly different. Donning of the universal gown, you will have the opening towards the back as you currently do with our current gowns. To secure these at the neck, there is a sticky part that you will remove to where it will allow it to stick to the opposite shoulder. These should be fairly tight at the neck so that they do not hang down and clothes are exposed. Next, you have strings that are located in the front. You will pull those around to the back to tie them, to secure them so that they do not come open while providing care. And then finally, you are going to apply your gloves. When applying your gloves, make sure that the cuff of the glove goes over the cuff of the isolation gown. That is how you will don the universal and trauma gowns. For doffing or removal of these gowns, pull them gently at the waist to untie them. You're then going to pull them up at the chest to remove the secure taping. You're going to fold it away from you, folding it on itself to make sure that the outer part of the gown is kept on the inside. Make sure that you remove the gloves at the same exact time and fold it away from you, making sure not to contaminate your clothes, into a small ball, and then you will dispose of it within the patient's trash. Secondly, we will show you how to don and doff the 2 extra large gowns. So donning of the 2 extra large gown, it will also have an opening in the back. The difference here is you actually have an opening that will go over your head. So you will apply that over your head and then your arms will slide through. The other difference is there are thumb holes on these gowns, so apply your thumb holes prior to applying your gloves. The strings for these, there is 1 string located on the front. The second string is located on the right side. Take the right side string around your back, bring it to the front, and secure on the left of your isolation gown. Once you have that secured, you will then apply your gloves. That is donning of the 2 extra large gown. For doffing of the 2 extra large gown, pull at the tie to break it loose. You're then going to pull at the chest to pull it away from your head, folding it on itself and removing your gloves at the same time and folding it away from you, making sure not to contaminate your clothes. As you are doing this, make sure to fold it in a small ball with the inner part that was against you is what you are touching. Once you have done that, please dispose of it into the patient's trash.